Hello, and welcome to Liberty's Passenger Assistance Training. Disclaimer: this training is for informational purposes only and should not be considered all-inclusive. Its material may not cover all applicable state, federal, and/or local statutes, nor does it address all possible scenarios faced by transportation employees. Liberty Mobility Now assumes no liability for incidents attributed to information received in this training presentation or lack thereof. Liberty's objective. This training is intended to assist transportation employees in providing safe, satisfactory, and lawful passenger assistance as they carry out their day-to-day duties serving the public interest. Let's look at our overview. Part 1, the Americans with Disabilities Act, ADA. Part 2, Safety, Professionalism, and Stellar Customer Service. Part 3, Assisting Passengers with Impaired Mobility. Part 4, Lift and Wheelchair Securement Procedures. Part 5, Disability Awareness. Part 6, Blood-borne Pathogens and Kidney Dialysis. And Part 7, Accidents, Injuries, Emergencies, and Evacuations. Let's begin with Part 1, the Americans with Disabilities Act, ADA. What is disability? Disability is defined as a physical or mental impairment that substantially limits one or more of the major life activities of an individual, a record of such an impairment, or being regarded as having such an impairment. A person is not defined by their disability. Did you know, as of 2010, almost 57 million Americans were living with a disability? That's almost 19% of the population. Disability is not unusual. Disability is a part of life. What is the Americans with Disabilities Act? ADA is a civil rights law founded in 1990. It prohibits discrimination on the basis of disability. It promotes accessibility for people with disabilities, for example, wheelchair accessible transit vehicles, culmination of decades of civil rights activism. In other words, people with disabilities should enjoy the same advantages available to non-disabled persons. The ADA was a response to an appalling problem: widespread, systemic, inhumane discrimination against people with disabilities. Before the ADA, most public transportation was unusable by people with mobility or visual impairments. Accessible buildings, sidewalks, and other criteria were the exception rather than the rule. People with disabilities were often denied basic rights, including the right to vote, obtain a driver's license, or even marry. Many states had involuntary sterilization laws for people with physical or intellectual disabilities. Cities, states had ugly laws banning people who were unpleasant to see from streets and public places. After the ADA, public transportation required to be accessible. Flat or ramped entrances to buildings became the rule rather than the exception. Let's talk about the ADA basics. Public entities may not deny people with disabilities the opportunity to use transportation services. If capable of using the system, transportation equipment and facilities must be accessible. Agencies and drivers must assist and reasonably accommodate people with disabilities.
Now we're going to discuss ADA basics in relation to you, the driver. You cannot discriminate against people with disabilities or refuse service because of a person's disability. You cannot decide for an individual whether it is safe or unsafe for them to use the service. Service can only be refused on the basis of violent, seriously disruptive, or illegal conduct. You cannot require a person with a disability to use seatbelts or shoulder harnesses when other riders on the same vehicle are not required to do so. You cannot pass by a person with a disability. If capacity issues preventing boarding, stop and inform the person that other arrangements will be made. Contact dispatch. You cannot require a person with a disability to use designated priority seats if the individual does not wish to use those seats. You cannot require the rider to transfer from a wheelchair to a regular seat, though you may ask or recommend it. You cannot require people with disabilities to be accompanied by a personal attendant. You cannot impose special fees on people with disabilities. You cannot refuse service for insurance or liability reasons. You must allow service animals. You must know how to operate all vehicle accessibility features, such as lifts and securement devices. You must also use these features when they are needed. You must assist passengers who have disabilities. You must assist unless doing so presents a direct threat to your health and safety. You are not required to perform the duties of a personal care attendant, such as duties that go beyond your fundamental role as a driver. A passenger should never have to ask for assistance. Offer assistance every time, even if it means leaving your seat. If injury occurs because you did not offer assistance, you are considered responsible. Never assist or touch a passenger without asking first. For safety, pay attention to any special instructions for certain passengers, such as a passenger with balance problems. You must know how to operate the lift or ramp whenever needed or requested. And you must allow anyone to use the lift or ramp even if you do not believe they have a disability. Disability is not always visible. You must allow the passengers to board the lift or ramp forwards or backwards. Report lift, ramp, or other equipment failures immediately. Here's a note regarding lifts and ramps. Never ask someone to identify their disability before they can use the lift or ramp. Anyone can use these features. You must transport any mobility device that fits the definition of a wheelchair and that your vehicle is capable of carrying. Questions such as, will the device fit on a ramp or within the securement area? Does the vehicle-rider combination weigh less than the maximum suggested ramp lift load? Then you must transport it. If the vehicle is capable of carrying the wheelchair, you can only deny service if doing so presents a direct threat to the safety of others. What is a wheelchair? A mobility aid belonging to any class of 3 or more wheeled devices, usable indoors, designed or modified for and used by individuals with mobility impairments, whether operated manually or powered. An electric scooter can be a wheelchair if it fits this definition. A recumbent bicycle, for example, is not a wheelchair because it does not meet the definition of being designed for individuals with mobility impairments. Wheelchair securement. You must attempt to properly secure all the wheelchairs in the vehicle securement system. A passenger cannot refuse to be secured if it is your agency's policy that all wheelchairs must be secured. However, if the wheelchair cannot be properly secured, you cannot refuse to transport the passenger. You must inform them that they are not secure and it is up to them whether or not to ride. You cannot refuse to transport a wheelchair that does not have brakes or wheel locks. You are not required to permit riders in wheelchairs to ride in places other than the designated securement area. If doing so would be a violation of company policy.
Now let's talk about service animals. What is a service animal? Any guide dog, signal dog, or other animal individually trained to work on or perform tasks for an individual with a disability, including but not limited to guiding individuals with impaired vision, alerting individuals with impaired hearing to intruders or sounds, providing minimal protection or rescue work, pulling a wheelchair, or fetching dropped items. Service animals can do amazing things. They can guide individuals who are blind, alert individuals who are deaf, pull a wheelchair, and assist during a seizure or predict seizures. Alert to the presence of allergens, retrieve items, provide support and assistance with balance and stability, prevent or interpret impulsive or disruptive behaviors. Service animals are not always dogs. They can also be miniature horses, monkeys, parrots, pigs, ferrets, etc. You must allow service animals to ride if they fit this description. A. Are required for a disability, and B. Are trained to perform a specific task. A comfort animal is not a service animal. Agencies are not required to allow comfort animals. For example, An emotional support rabbit is not a service animal, as providing emotional support is not a specific task. You may not ask for or require proof that an animal is indeed a service animal. However, you may ask if the animal is required for a disability and what task it is trained to perform. Caring for the service animal is the responsibility of the passenger. You may refuse a service animal if it poses a distinct threat to safety, creates a serious disruptive atmosphere, or is otherwise not under the rider's control. You may not refuse a service animal based on your past experience or knowledge of certain breeds, example, a pit bull. You may not refuse a service animal based on personal or passenger allergies. Note: service animals should rest on the floor, not in a seat. When operating the lift, watch out for paws, furry tails, or ears. This could result in injury to the service animal. Never give commands to, touch, or otherwise distract a service animal without the owner's permission. They have a job to do. Quiz, Part 1. The Americans with Disabilities Act. A. Prohibits discrimination against people with disabilities. B. Is a civil rights law. C. Requires public transportation to be accessible for people with disabilities. Or D. All of the above. The correct answer is D. All of the above. 2. True or false? Service can be denied to a person with a disability if it would disturb or inconvenience other passengers. The correct answer is false. 3. True or false? Some passengers with disabilities must be accompanied by a personal attendant if they wish to ride. The correct answer is false. 4. True or false? Under no circumstances can you deny transportation to a passenger in a wheelchair. The correct answer for number 4 is false. Number 5. To ride, a service animal must A. Be required for a disability and trained to perform a specific task. B. Weigh less than 100 pounds. C. Be a dog. D. Be trained to assist persons with visual impairments. The correct answer to number 5 is A. Be required for a disability and trained to perform a specific task. Number 6. True or false? Before a service animal can board, you may ask the owner for proof that the animal is a certified service animal. The correct answer is false. Number 7. You must offer assistance for passengers with disabilities. A. If a passenger is noticeably struggling. B. As long as assisting would not require you to leave your seat. C. Every time. D. When given special instructions by a healthcare provider. E. Only for passengers with impaired mobility. The correct answer to number 7 is C. Every time. Number 8. Who can use the vehicle lift? A. Persons with a noticeable disability. B. Persons in a wheelchair only. C. Anyone can use the lift. Or D. Persons who have a disability or who are elderly. The correct answer to number 8 is C. Anyone can use the lift. Number 9. Can a passenger with a wheelchair refuse to be secured? A. No. B. Not if it is my agency's policy that all wheelchair passengers must be secured. C. Yes, it is their right under the ADA. D. Only if securement would cause them discomfort. The correct answer to number 9 is B. Not if it is my agency's policy that all wheelchair passengers must be secured.
Now it's time for Part 2, Safety, Professionalism, and Stellar Customer Service. What is a professional? A professional possesses unique skills, training, and qualifications that are put to use to provide a valuable service. For example, non-emergency medical transportation drivers are licensed to operate a motor vehicle, drug-free, and trained to transport passengers who have disabilities or medical issues. NEMT drivers also tend to have the desire to help others, a strong work ethic, a compassionate attitude, and great people skills. Question: what makes a great driver? Qualities of a great driver: loves to drive, Safety conscious at all times, defensive driver. Performance not impacted by mood, got a job to do. Motivated to provide excellent customer service. Let's talk about safety. Safety is priority number 1. Types of accidents. 1. Those that are unavoidable. For example, someone changes lanes into you. Those that are caused or contributed to by preventable factors. Examples of avoidable crash factors. Distracted driving. For example, texting, talking, eating, operating the radio, etc. Drowsy driving. Driving under the influence of drugs or alcohol. Includes driving while hung over. Speeding. Aggressive driving. Disobeying traffic rules. Erratic lane changing. Stressed out driving. Driving while angry. Trying to beat the light. Being inattentive to other drivers. You can avoid crashes by being in control of yourself. For example, getting enough sleep. Being a defensive, non-distracted driver. Being aware of other drivers. Caring about your passengers' well-being. Safety tips. Just say no to distracted driving. Be the most responsible driver on the road at all times. Get enough sleep. If you are under the influence at work, prepare for unemployment. Avoid and manage stress when you can, or try to leave it at home. Yellow means slow down, not speed up. Be on the lookout for inattentive, distracted drivers. Obey traffic laws. If it could get you pulled over, you're doing it wrong. Make sure you are mentally and physically prepared before each and every shift. Remember, as a driver, the lives of others are literally in your hands. Someone cares deeply about each and every one of your passengers, and your company cares about you. To be a safe driver, practice stress management. Stress is a part of life. Stress is a mental and physical reaction to life events, both small and large. Stress can accumulate and it can impact job performance. Take care of yourself. Stress can cause physical damage to your body and mind in the form of poor sleep or lack of sleep, headaches and other physical reactions, missed meals, overeating and unhealthy eating, anxiety, depression, etc. Tips for managing stress. Try to manage stress before it accumulates. Make sleep and healthy eating a priority. Get some exercise. This has been shown to be as effective as antidepressant medication. Drink some water. Talk it out. Don't hold it in. Take some time off if necessary. No one is Superman or Wonder Woman.
Let's talk about customer service. When it comes to customer service, the Liberty way of thinking revolves around courtesy, compassion, kindness, and respect. And EMT drivers are compassionate because they serve some of our nation's most vulnerable residents. For instance, the elderly, people with physical or intellectual disabilities, people who are low income and lack reliable transportation, people who would have no other way of getting to the doctor. Working with at-need populations means NEMT drivers should practice a higher level of customer service than you might find elsewhere. Your passengers are counting on you. Remember to offer assistance. Do you think your customer may require assistance? Remember to ask, "May I assist you?" and "How may I assist you?" Disability is not always obvious. For example, intellectual disability or mental illness. When in doubt, offer assistance. If assistance is refused, stay close by in case you are needed. Be sensitive to passenger needs. Does your passenger have a physical or cognitive disability? Are there special instructions that need to be followed for a certain passenger? Does your passenger need extra time and care to board the vehicle, pay the fare, or get to their seat? Sensitivity also refers to practicing awareness and professionalism in speech and action when interacting with customers. For example, sensitivity means not using labels like crippled, handicap, or mentally challenged to refer to a person or their disability. Remember to use people first language. People first language includes a person with visual impairment instead of a blind person, a person with a physical disability instead of a handicapped person, a person with an intellectual disability instead of a mentally challenged person. Accessible parking rather than the handicap spot. Practice cultural and social awareness. Discriminatory words or behaviors involving a person's race, color, sex, age, religion, or sexual orientation are prohibited under federal law. Avoid discussing topics that focus on politically charged issues that may offend others. Be sure to hone your communication skills. Being a superb communicator starts with being a great listener. Passengers may have questions or requests for assistance. Pay attention. If you cannot understand a passenger, do not pretend to understand. Say, "I'm sorry, I couldn't understand you. Can you please repeat that?" If language barriers are an issue, remember that you have access to an interpreting service through the Liberty Dispatch Center. Just be as cool as a cucumber. As hard as you try, you can never make everyone happy all the time. Some passengers will complain. Good service often goes unnoticed. Bad service is always remembered. You cannot always control whether a customer will complain, but you can remain courteous and professional at all times. When fielding customer complaints, be sure to listen to the complaint. Make the complainant feel heard. Try to see the complainant's point of view and then calmly explain company policy or procedure. Be sure to document and report incidents. If an incident occurs that makes you uncomfortable, document it when you can. Write down what occurred, when, and who was involved, whether there were witnesses to the event, or details you think are relevant. Finally, the obvious. Be sure to maintain your vehicle and your personal appearance. Your vehicle and personal appearance should be clean and professional at all times. No smoking in the vehicle. And be sure to maintain good personal hygiene. Now, let's prepare for our quiz over Part 2. Question number 1. The number 1 priority for professional drivers is A. Superb customer service, B. Assisting people with disabilities, C. Safety, or D. Timeliness. The answer to number 1 is C. Safety. Safety is always our number 1 priority. Question number 2. True or false? Being an aggressive driver is acceptable when running behind schedule. The answer to number 2 is false. Question number 3. True or false? You should wait for a passenger's permission before trying to assist them. The answer to number 3 is true. Question number 4. Name one possible negative side effect of stress on human health. There are different answers: impaired sleep, appetite, etc., and those are just a few of the possible negative side effects that stress can cause on human health. Question number 5. True or false? Handicapped is a politically correct term for people with disabilities. The answer to number 5 is false. Number 6. Change this phrase to people first language. A blind person. Is it A, a visually impaired person, B, a person with visual impairment, C, a visually disabled person, or D, a sight challenged person? If you guessed B to question number 6, you're correct. Question number 7. If a passenger complains, you should A, ignore the complaint, let it roll off your back, B, call dispatch immediately to inform them of the complaint, C, listen to the complainant and try to resolve the complaint if possible, D, explain company policy and procedure, or E, both C and D. The answer to number 7 is E. Both C and D are correct. Number 8, true or false? Most disabilities are obvious and easy to spot. The answer is false. Number 9, above all else, a professional driver should always be on time, B, courteous, C, a safe, defensive driver, D, conscious of a passenger's disability. The answer to number 9 is C, always a safe and defensive driver. Number 10, true or false? Mentally challenged is an appropriate term for a person with an intellectual disability. If you said false to number 10, you're correct.
Now let's move on to Part 3, assisting passengers with impaired mobility. Let's talk about types of mobility equipment and their features, using the vehicle lift and wheelchair securement. Mobility equipment and features. What are the most common types of personal mobility equipment? What do I need to know about assisting mobility-equipped passengers? Wheelchairs are manually operated or power-driven devices used for mobility. Wheelchairs can have 3 or 4 wheels. They may come in a variety of sizes and designs. They may not always look like a common wheelchair. Every wheelchair must be transported if it cannot fit on the lift, usually 30 inches wide by 48 inches long, and in a vehicle securement area. If a wheelchair cannot be secured, inform dispatch. Wheelchair assisting tips. Many users consider their wheelchair as an extension of their body. Unnecessary touching or leaning may be considered rude. Use smooth and gentle movements. Avoid rough bumps, jerks, or potholes. Use verbal cues to inform the passenger when you are going to start moving the wheelchair. Treat wheelchairs with care. Avoid scratching or otherwise damaging the wheelchair. Watch for and report defects to the wheelchair user, such as loose wheels or underinflated tires. Pay attention when you are pushing or pulling the wheelchair. The center of gravity of an occupied wheelchair is approximately the top of the armrest. Use slow and steady movements. Make turns and take curves cautiously. When moving a wheelchair, watch for obstacles and slippery pavement. When going up an incline, position yourself behind the wheelchair to push forward. When going down an incline, position yourself behind the wheelchair, facing the direction you are coming from, while holding the hand grips. Contact dispatch or appropriate personnel in the event of mechanical issues you cannot resolve. Note: you can allow a passenger to move to a vehicle seat, but you cannot force them to do so. You may not refuse to transport a wheelchair user on the grounds that their wheelchair does not have brakes or wheel locks, or that the user refuses to set them. Walkers. Walkers are used for balance and support. The knee walker is used for ankle or foot injuries. Most walkers have wheels, brakes, and a seat for resting. Most can be folded for convenient transport and storage. Walker assistance tips. Passengers using walkers may move slowly or have balance issues. When assisting, allow for slow movements. Walkers may make navigating stairs difficult or even impossible. In most cases, use the vehicle's accessible entrance for passengers on walkers. This is usually the safest approach. Canes. Canes are used for balance and support. Some have multiple feet for added support. White canes are reserved for people who are legally blind. They help locate objects and surface features when the user taps the ground. Cane assistance tips. If assisting a passenger who uses a cane, provide assistance from the side opposite of the cane. Be sure to ask the passenger if they would like assistance and how you can assist them. If assisting a person who is legally blind, be sure to ask before touching the cane. Crutches. Crutches assist with balance and weight support. There are 2 basic types: underarm or forearm crutches. Crutches are most often the result of injury. Exercise care when assisting passengers on crutches. Crutches may make navigating vehicle stairs extremely difficult or impossible. Using the vehicle lift may be the safest bet when entering or exiting the vehicle. Prosthesis. A prosthesis is an artificial device used to replace a missing body part. Walking slowly and being sensitive to heat are possible side effects of having a prosthesis. Prosthesis assistant tips. Limb loss reduces the ability to sweat. Amputees can overheat easily. Watch for signs of hypothermia. Extreme fatigue, nausea, vomiting, shortness of breath, flushed hot skin, dizziness, or vertigo. General passenger assistance guidelines. Remember to offer assistance and ask what type of assistance is desired. If not assisting, stay close by and pay attention to avoid falls or accidents. Be patient. Don't hurry passengers with mobility impairments. Put yourself in the passenger's shoes. Try to anticipate their needs. True or false? If a wheelchair cannot be properly secured, you should not transport it. The correct answer to number 1 is false. If a wheelchair cannot be secured, inform dispatch. Number 2. The center of gravity of an occupied wheelchair is A. At the top of the wheels, B. At the passenger's midsection, C. At about the top of the armrests, or D. Not a safety concern. The correct answer to number 2 is C. At about the top of the armrests. 3. When guiding a wheelchair down an incline, you should be positioned A. Behind the wheelchair facing the direction you are coming from, B. Behind the wheelchair facing the direction you are going, C. Either A or B is acceptable. The correct answer to number 3 is A. Behind the wheelchair facing the direction you are coming from. 4. True or false? When the vehicle is full, it may be necessary to require a wheelchair passenger to transfer to a regular seat. The correct answer to number 4 is false. 5. When assisting a wheelchair passenger, you should avoid scratching the passenger's wheelchair, unnecessary touching or handling of the passenger's wheelchair, C. Bumps and potholes, D. Obstacles and slippery pavement, or E. All of the above. The correct answer to number 5 is E. All of the above. Number 6. True or false? You should ask a passenger on crutches whether they would like to use a wheelchair lift. The correct answer to number 6 is true. Number 7. When assisting a passenger with a white cane, you should assist from A. The side opposite of the cane, B. The left side, C. The right side, D. A distance of approximately 3 feet. The correct answer to number 7 is A. The side opposite of the cane. Number 8. A passenger with a prosthesis may be particularly susceptible to A. Headaches, B. Back pain, C. Overheating, or D. Pneumonia. The correct answer to number 8 is C. Overheating. Number 9. True or false? You should not ask a passenger's permission to assist them into their seat. Assistance goes without saying. The correct answer to number 9 is false. Number 10. True or false? You should not provide assistance if doing so requires you to leave your seat. The correct answer to number 10 is false.
Welcome to Part 4, Vehicle Lift and Wheelchair Securement Procedures. Wheelchair lift procedures. Who can use the lift? Anyone who requests it can use the lift. Any standee should use both handrails and stand in the middle of the platform. Never ask a passenger what their disability is that would require them to use the lift. General considerations. The lift must be operated from the ground outside the vehicle. Do not remain in the vehicle when raising or lowering the lift. In general, do not ride the lift with a passenger, unless it's necessary for the passenger's stability or balance. How do I use the lift? While standing on the ground, use one hand to stabilize the wheelchair and one hand to operate the lift controls. Raise the lift slightly, about 2 inches. Check to make sure the front safety barrier is locked. When certain that it's locked, raise the platform to the vehicle floor level. Secure the lift controls with one hand while holding on to the wheelchair with the other. Release the wheel locks and push the wheelchair into the vehicle. Reach in and lock one wheel. Never leave a wheelchair on the lift platform unattended. When boarding, push the wheelchair into the vehicle. When exiting, pull it out. The lift must be routinely checked and, if needed, serviced. Report all non-operating lifts immediately. There are many styles of lifts. Drivers should follow procedures for their vehicle's specific type of lift. Know your lift's passenger or device weight limit. Using the wheelchair securement system. Securement systems have two parts. One system to secure the wheelchair and another to secure the wheelchair user. Securements are intended to limit the movement of mobility devices. Only 2 inches of movement in any direction should occur under normal operating conditions. Each securement system should include 4 floor-mounted belts to secure the wheelchair, plus a lap and shoulder belt to secure the occupant. All belts must be used every time for every passenger. All wheelchairs should be positioned to face forward unless the system is specifically designed to have rear-facing passengers. Attach the straps no more than 3 to 8 inches in front of the front wheels to provide side-to-side stability. Do not allow the straps to wrap around or interfere with any part of the chair. Try to position the straps at a 45-degree angle for the most stability. When positioning the wheelchair for securement, center the chair between the floor plates or tracks. Apply brakes on a manual wheelchair or turn off power on a motorized chair. Rear strap procedure. Attach the straps to the floor just inside the rear wheels. Pull upward on the strap to tighten and check to make sure it is secure. Only attach the straps to the permanent part of the chair as close to the seat cushion as possible. A 45-degree angle is ideal for maximum stability. Positioning the lap belt. The lap belt is to be worn across the pelvic area, with the shoulder belt attached to a buckle at the hip area. This prevents the occupant from sliding out of the chair in the event of a sudden stop. Make certain that the belt is not across the abdominal area and is pulled tight enough for a firm and comfortable fit. Positioning the shoulder belt. Place the shoulder belt across the collarbone area, diagonally across the chest, connected to the attachment on the lap belt. Adjust the belt to provide a snug and comfortable fit. General precautions. Always check for proper securement of all belts before moving the vehicle. There should be only 2 inches of movement in any direction. Do not position straps around the wheels or on detachable parts of the chair. Always use the same style of strap and buckle at each end of the chair. This saves time in emergency situations. Never attach the straps to the crosspiece under the wheelchair. This could cause collapsing or tipping of the chair in the event of a sudden stop. Part 4 Quiz. True or false? Only people with disabilities are allowed to use the wheelchair lift. The correct answer is false. Question 2. When is it okay to ride the wheelchair lift with a passenger? A. Never. B. Always. C. Only when absolutely necessary for the safety of the passenger. Or D. Only when the passenger requests it. The answer is C. Only when absolutely necessary for the safety of the passenger. Question 3. The lift should be operated A. from inside the vehicle, B. from the ground outside the vehicle, or C. only for passengers using a wheelchair. The answer is B. from the ground outside the vehicle. Question 4. Before raising the lift, you should always make sure A. the front safety barrier is locked, or B. the front safety barrier is unlocked. The answer is A. the front safety barrier is locked. Question 5. True or false? Standing on the lift is never permitted. The answer is false. Question 6. The recommended allowable movement of a wheelchair in any direction when secured is A. 1 foot, B. 6 inches, C. 3 inches, or D. 2 inches. The answer is D. 2 inches. Question 7. True or false? When securing a wheelchair, you should always make sure the wheel brakes are unlocked. The answer is false. Question 8. True or false? It is okay to ask a passenger to identify their disability before allowing them to use the lift. The answer is false. Question 9. When securing a wheelchair, the passenger should usually face A. forward, or B. in the opposite direction toward the vehicle's windows. The answer is A, forward. Question 10. A malfunctioning lift or securement system must be reported A, within 14 days, B, within 30 days, C, within 24 hours, or D, immediately. The answer is D, immediately.
We are now going to discuss Part 5, Disability Awareness. What is a disability? A disability is a physical or mental impairment that substantially limits one or more of the major life activities of an individual. A record of such an impairment, or being regarded as having such an impairment. Disabilities vary greatly in their type, severity, and the degree to which they impact well-being. No two people are alike. Not all disabilities are visible. Emphysema, asthma, cognitive disabilities, mental illness, or HIV and AIDS. Disability is common. As of 2010, nearly 57 million Americans were living with a disability. That is nearly 1/5 of the U.S. population. People with disabilities are really no different than you and me, yet they face challenges that many of us have a difficult time understanding. You can make a difference. By having a greater understanding of the challenges faced by people with disabilities, you can provide exceptional customer service, make life easier for people with disabilities, and ensure transportation is safe and accessible. Tips for assisting people with disabilities. General considerations. Offer assistance and wait for permission. A passenger with a disability should never have to ask for help, but you should not assume that they can do things on their own. A person is not defined by their disability. Disability does not equal helplessness. To provide the best assistance, put yourself in someone else's shoes. How would you like to be treated? Tips for assisting passengers with visual impairment. Identify yourself. Speak in a normal tone and speak directly to the person. This will help them locate you. Don't say "over there" or rely on hand or facial gestures. A visually impaired rider may not see your vehicle approach. Verbal communication is important. Announce stops and destinations. Respond verbally when a visually impaired passenger speaks to you. When guiding, offer an arm or an elbow. Don't grab, push, or tug. Show the passenger where your arm is by placing his or her hand on your arm. Stand alongside and slightly ahead. Walk at a normal pace. Verbally identify obstacles such as landmarks, stairs, or curbs. Be specific. Do not handle the person's cane unless asked. When directing a visually impaired passenger to their seat, place their hand on the back of the seat and let them use the sense of touch to determine the location and size of the seat before sitting down. When necessary, example, if coming too close to an obstacle or hazard, use the word stop. It only has one meaning: cease what you are doing. Remember, people with hearing impairments rely on what they can see. Attract the person's attention before speaking. Speak in a loud and clear voice. Speak directly to the person, even if they are using an interpreter. Avoid chewing gum. Stand in front of bright lights, etc., which can obstruct the view of your mouth and make lip reading difficult. Text or pictures can, at times, be an effective form of communication. Helpful tips. Keep a pen and paper in your vehicle to assist in communicating with passengers who have hearing impairments. Assisting passengers with impaired mobility. People with mobility impairments can still be highly independent. Offer assistance, but ask first. If assistance is denied, remain close by to monitor for balance issues, etc. Be sure to provide information about vehicle accessibility features, such as lifts or ramps, and use these features. Position yourself at eye level when possible. Example, when speaking to a person in a wheelchair. Always secure wheelchairs using your vehicle's securement systems. Assisting passengers with cognitive disabilities. Cognitive disabilities may be invisible to the eye and range in severity. Cognitive disabilities can impact a person's ability to understand you, make basic life decisions, perform basic actions, remember information, etc. Use simple words and short sentences. Break down information into concise steps. It may be necessary to repeat information more than once. Be patient. Confirm that the passenger understands the information. Assisting passengers with language or speech impairments. This can be caused by many different factors, including speech disorders, cerebral palsy, brain injury, autism, Alzheimer's, or strokes. Do not assume that speech impairment is accompanied by cognitive impairment. When communicating, do not interrupt or pretend to understand. Allow the speaker to finish, then ask questions as necessary. Ask questions that require short answers. Assisting passengers with behavioral health disorders or mental illness. These symptoms may range widely. They can include excessive anxiety, fears or phobias, hallucinations, repetitive behavior, difficulty with stimulation, sadness or high stress levels. Remain calm and speak in even tones. Make suggestions, not demands. Ask simple questions. Repeat if necessary. Listen as a primary means of communication. Assisting older adults. Older adults can have a range of impairments, example visual or hearing, cognitive, and may be susceptible to balance issues and falls. Always offer assistance. If refused, remain nearby to respond in the event of a fall. Speak to older adults as adults. Exercise patience. Do not rush. Allow adequate time for boarding and deboarding. Assisting passengers with cerebral palsy. Cerebral palsy is a group of conditions caused by damage to the brain before, during, or shortly after birth. This is not a disease. Cerebral palsy can affect posture, muscle control and coordination, and senses. It may cause balance problems, difficulty walking, or difficulty using limbs. It may also cause impaired speech. Use yes or no questions and allow the passenger adequate time to answer. Also, allow for slow movements. Assisting passengers with autism spectrum disorder. Autism may impact a person's behavior, communication, learning, and interaction. Passengers may insist on sameness, example, the same routine or route, and can become upset with changes. May interpret words and phrases literally, and may ask a lot of questions. Allow time for responses and expect frankness. Do not expect eye contact or become offended at its absence. No touching without asking. Be patient and understanding. Assisting passengers with Alzheimer's disease. Alzheimer's disease affects memory, speech, and other intellectual skills. People with this disease experience changes in their mood, personality, and behavior. They may require repeats of information, including their own address or where they are traveling. Individuals with Alzheimer's may wander. Therefore, door-to-door service may be required. They may at times become violent or display other inappropriate forms of behavior. When assisting a passenger with Alzheimer's disease, be patient. Do not provide an overabundance of information. Encourage the person to sit towards the front of the vehicle. Assisting passengers with learning disabilities. Learning disabilities can affect the way a passenger obtains, stores, and processes information. It can lead to short attention span or poor memory. May have difficulties with communication or reasoning. May have unrefined social skills. Be patient and understanding. Be clear and concise. Repeat information if necessary. Check for comprehension of information. Offer information at its simplest format. Assisting passengers with intellectual disabilities. Intellectual disabilities usually manifest before the age of 18 and can range in severity. Intellectual disability is not the same as mental illness. May have difficulty understanding basic information, lack basic social skills, perform basic tasks slowly. May have difficulty with self-expression. May be unable to read. May be very affectionate. May function differently day to day. May learn by watching. Treat adults as adults, not as children. Use eye contact and communicate in simple words and short sentences. Sometimes showing is the most effective way of teaching. Repeat information as necessary. Be patient. Assisting passengers with traumatic brain injury. Persons with traumatic brain injury may have difficulty paying attention or concentrating, remembering, moving, performing tasks, understanding complex information, etc. May require assistance performing basic tasks. Offer assistance. Present information in the simplest form. Repeat information as necessary. Transporting at-risk passengers. Spot the signs of a stroke. Stop a diabetic emergency. Recognize ketoacidosis. Respond to seizure events. Spot the signs of a stroke. A stroke is an interruption in the blood supply to the brain, which may cause paralysis and a loss of feeling on one side of the body, may cause memory loss and confusion, may cause difficulty speaking and understanding, can make even simple tasks more difficult than they were before. Signs and symptoms of stroke. Sudden weakness or numbness in the face, arm, or leg, especially on one side of the body. Slurred words, trouble talking or comprehending speech. Blurred or dimness of vision in one or both eyes. Unexpected dizziness, loss of balance, or sudden fall. Sudden severe headache with no apparent cause. Questions to determine whether someone may be having a stroke. Ask the individual to smile. Ask him or her to raise both arms. Ask the person to speak a simple sentence such as, "It is a sunny day today." Or ask a false question to check comprehension. Example, "Do airplanes have babies?" If he or she has trouble with any of these tasks, call 911 immediately and describe the symptoms to the dispatcher. Remember, acting quickly in the event of a stroke could be the difference between life and death. When in doubt, call 911. Spot a diabetic emergency. Diabetes is a disease in which the person does not produce or properly use insulin. Type 1 diabetes results from the body being unable to produce insulin, most common among children and young adults. Type 2 is the most common form of diabetes and occurs among people of all ages. Signs of a diabetic emergency. Extreme thirst, dry mouth, warm or dry skin, high fever, sleepiness or confusion, loss of vision, hallucinations, or weakness on one side of the body. In the event of a possible high blood sugar diabetic emergency, call 911 immediately and ask the passenger to drink as much water as possible. Signs of a diabetic emergency. Hunger, sweating, sleepiness, trouble speaking, nervousness or shakiness, dizzy or lightheaded, confused or feeling anxious or weak. In the event of a possible low blood sugar diabetic emergency, call 911. Ask the passenger to eat or drink a small amount of food containing sugar, such as 1 or 2 pieces of hard candy or a half cup of fruit juice. Ketoacidosis. Ketoacidosis is a serious condition caused by high blood sugar, can cause diabetic coma and result in death. Watch for any of the following symptoms: thirsty or very dry mouth, frequent urination, constantly feeling tired, dry, flushed or red skin, possible nausea, vomiting, or stomach pain, short deep breaths, short attention span, or confusion. A very noticeable fruity breath odor. Reacting to seizure events. Epilepsy or seizure disorders result in seizure events that may be unpredictable. Though medication can control seizures, they can take place even while a person is medicated. The body becomes stiff, followed by rapid jerking or shaking motions. The affected person may have frothing or saliva at the mouth. They may fall into deep unconsciousness and may lose bowel and bladder control. Seizures usually last only 2 to 5 minutes, but can last longer. Remain calm and pull the vehicle safely to the side of the road. Place a folded sweater, jacket, or pillow under the head of the passenger to prevent injury. Similarly, make sure no objects are nearby that could fall on the passenger. Allow the seizure to run its course. Do not attempt to restrain a person during a seizure. Physical contact can prolong the seizure. Do not try to prevent the person from swallowing their tongue. It is impossible to do so. As soon as possible, inform dispatch. If a passenger has one seizure after another, or a seizure lasts more than 10 minutes, call 911. Part 5 quiz. Number 1. True or false? Mental illness is a form of disability. The correct answer to number 1 is true. Number 2. As of 2010, approximately blank Americans had a disability. A. 57,000. B. 57 million. C. 1 million. Or D. 900,000. The correct answer to number 2 is B. 57 million. Number 3. True or false? You should wait for a person with a disability to ask before you offer assistance. The correct answer to number 3 is false. 4. When speaking to a person with hearing impairment, you should speak A. at least twice your normal volume, B. directly to the person, not their interpreter, C. only using gestures or pictures, or D. using only your lips. The correct answer to number 4 is B. directly to the person, not their interpreter. Number 5. True or false? Speech impairment is almost always accompanied by cognitive disability. The correct answer to number 5 is false. Number 6. If you suspect a health emergency, the first thing you should do is A. Call dispatch. B. Try to diagnose exactly what is happening to the passenger. Try to administer first aid. Or D. Dial 911. The correct answer to number 6 is D. Dial 911. Number 7. One of the major signs of stroke is A. Nausea or vomiting. B. Back pain. C. Slurred speech or words. D. Facial drooping. Or E. Both C and D. The correct answer to number 7 is E. Both C and D. Number 8. True or false? When a passenger is experiencing a seizure, you must take special precaution to prevent them from swallowing their tongue. The correct answer to number 8 is false. Number 9. During an obvious low blood sugar diabetic emergency, the first thing you should do is A. Call 911. B. Ask the passenger to consume sugary food or drinks. C. Ask the passenger to drink large quantities of water. Or D. Attempt to locate and administer the passenger's medication. The correct answer to number 9 is A. Call 911. Number 10. When assisting a passenger with visual impairment, you should always A. Announce upcoming stops. B. Announce the presence of obstacles, such as curbs. C. Identify yourself. D. Respond verbally to questions or requests for assistance. Or E. All of the above. The correct answer to number 10 is E. All of the above.
Now it's time for Part 6, Blood-borne pathogens and kidney dialysis. What are blood-borne pathogens? Blood-borne pathogens are viruses carried by the blood. Examples include, but are not limited to, hepatitis B and HIV. By exercising universal precautions and following proper procedures, you can reduce or eliminate your risk of exposure and illness. What are universal precautions? You should treat all blood and bodily fluids as potentially infectious. If you come into contact with any bodily fluids, make sure to wash your hands thoroughly before touching your mouth, nose, or eyes. Unbroken skin is a good barrier against pathogens. However, any break or cut can allow pathogens to enter your body. Learn to recognize risk situations. Drivers sometimes risk coming into contact with bodily fluids as a result of accidents, incidents while transporting dialysis patients, etc. A biohazard clean kit or spill kit should be present in every vehicle and must be accounted for during pre-trip inspections. Furthermore, all drivers should know the proper procedures for using the spill kit. Always follow universal precautions when dealing with bodily fluids. For example, wash your hands and avoid contact with broken skin. What are common types of blood-borne pathogens? Hepatitis is a general term that refers to inflammation of the liver. It can be caused by viruses, alcohol, or chemical exposure. Hepatitis can also result in cirrhosis of the liver, which is scarring or permanent liver damage. Hepatitis A is a virus that's spread by food or water being contaminated with feces. Most people never know they have it and recover on their own. In fact, it infects about 35,000 people in the United States each year. Currently, there's no cure for hepatitis A, but symptoms can be treated individually. There's also a vaccine available. Hepatitis B is a virus that causes serious liver disease and can be fatal. It can take 45 to 160 days to develop symptoms of hepatitis B. Hepatitis B is a virus that causes serious liver disease and can even be fatal. It can take 45 to 160 days to develop symptoms, and it can be transmitted by contact with infected blood or other bodily fluids, including saliva, urine, semen, or feces. Hepatitis B is 50 to 100 times more infectious than HIV. It can survive in dried blood for up to 7 days. Currently, there's no cure available, but there is a vaccine. If you believe you've been in contact with hepatitis B, you should see your doctor within 2 weeks for possible vaccination. Human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome, AIDS. HIV is the virus that leads to AIDS. It is not transmissible through casual contact. Instead, it's transmitted through blood or blood-contaminated bodily fluids. Currently, there's no cure or vaccine available. When HIV develops into AIDS, or acquired immunodeficiency syndrome, the body's immune system is compromised, leading to increased risk of opportunistic infections through viruses, bacteria, etc. Transporting passengers with HIV or AIDS. Remember, HIV and AIDS are not spread through casual contact, like handshakes, but always avoid contact with blood and other bodily fluids. If exposed, make sure to practice universal precautions. And remember, when transporting passengers with HIV or AIDS, maintain confidentiality. What if a passenger is injured or becomes ill? Remember to remain calm. In the event of a health emergency, make sure to dial 911 immediately. Then, assist that person as necessary, while remembering to exercise universal precautions. Remember, treat all bodily fluids as potentially infectious. Use a biohazard or spill kit and wear rubber gloves if cleaning up bodily fluids. Inform your dispatcher if a passenger is injured or becomes ill. Understanding kidney dialysis. The kidneys maintain the body's fluid levels by excreting fluids when the body has excess and conserving them when dehydrated. They also assist in regulating blood pressure by removing excess fluid and producing a chemical called renin. Amazingly, your kidneys can filter your body's entire blood supply every 2 minutes. The kidneys remove waste from the blood and discharge it through the bladder as urine. In the event that one kidney stops functioning, the other can easily perform the job of both. What is hemodialysis, or kidney dialysis? In the absence of adequate kidney functioning, hemodialysis is an artificial process of removing waste and excess fluid from the blood. Blood is removed to an artificial kidney machine for cleansing. Then it's returned to the body's blood supply. A shunt is implanted outside the body and a fistula inside the body. Considerations. Dialysis treatment can cause patients to feel extremely weak, ill, or tired. Patients can also carry many pounds of excess body fluid prior to their treatment. Passengers who undergo dialysis should receive assistance in moving. They may need to use the lift to enter and exit the vehicle. Some patients require multiple dialysis visits per week of up to 4 hours per visit, and missed appointments can be life-threatening. Post-dialysis symptoms. These can include scratching or dry skin, poor vision. They may require assistance standing, walking, and entering or exiting the vehicle. Keep an eye out for any bleeding from the blood supply access point. If this occurs, you need to seek medical attention immediately. It's time for the Part 6 quiz. Number 1. Blood-borne pathogens are A. Bodily fluids, B. Viruses carried by the blood, C. Diseases that can only be transmitted through direct contact with blood, or D. By definition, always highly contagious. The answer is B. Viruses carried by the blood. 2. When potentially exposed to blood or other bodily fluids, you should A. Exercise universal precautions, B. Visit a doctor immediately, C. call dispatch to send a cleanup crew, or D, do nothing out of the ordinary. Viruses can't survive outside the body. The answer is A, exercise universal precautions. Question 3, true or false? All blood or bodily fluids are potentially infectious. The answer is true. Question 4, a biohazard clean kit should A, be present in every vehicle, B, be accounted for during pre-trip inspections, C, be requested from dispatch in the event of a spill, or D, both A and B. The answer is D, both A and B. Question 5. Hepatitis B can survive in dried blood for A, 24 hours, B, up to 6 weeks, C, less than 5 minutes, or D, up to 7 days. The answer is D, up to 7 days. Question 6. HIV is transmissible through A, casual contact, such as handshakes, B, sweat, C, sneezes or coughs, or D, blood or blood-contaminated bodily fluids. The answer is D, blood or blood-contaminated bodily fluids. 7. True or false? Following dialysis treatments, patients usually feel refreshed and energized due to the removal of toxins from the blood. The answer is false. Question 8. True or false? 1 or 2 dialysis visits can be missed with virtually no complications. The answer is false. 9. Post-dialysis patients require medical treatment immediately if this occurs. A, dizziness or headaches, B, weakness, C, bleeding from the blood supply access point, or D, dehydration. The answer is C, bleeding from the blood supply access point. Question 10. True or false? For their safety, it is okay to warn other passengers that your most recent transport had HIV. The answer is false.
Let's review Part 7, Accidents, Incidents, Emergencies, and Evacuations. In the event of an emergency, you are responsible for handling the situation in a way that lessens the risk of injury or death to your passengers and yourself. The 4 basic accident emergency procedures include: Number 1, keep calm and take control. No one knows your vehicle better than you. You may be the only one with a mobile phone. You are the authority figure on board. It is your responsibility to be the rational decision maker. Number 2, protect your passengers, yourself, and your vehicle. Determine whether the vehicle needs to be evacuated and whether it is safe to do so. Help passengers reach a safe location. Always be mindful of secondary hazards. Use available first aid and safety equipment if necessary and safe to do so. Do not neglect your own safety. Always remember to call 911 if necessary after you and your passengers are out of harm's way. Number 3, contact your dispatcher. When safe to do so, notify dispatch of the event and your precise location. Account for the condition of yourself and your passengers, and ask for directions on how to proceed. Number 4, complete the required paperwork. Post-event paperwork may be required to address issues of liability, etc. You are responsible for completing these reports in detail and in a timely manner, and for providing additional requested information. Evacuation. If you smell or see smoke, or smell gasoline or diesel fumes, evacuate the vehicle immediately. When in doubt, never assume an emergency is not occurring. Always err on the side of safety. The lift may be damaged or unusable. Conditions, example, fire, may be time restrictive. Determine quickly whether this method of evacuation is appropriate for wheelchair passengers. The decision to evacuate mobility devices should be based on a sound assessment of the danger. Do not waste time during an emergency. Saving lives is your first priority. Always be aware of secondary hazards, for example, oncoming traffic. Be aware of the presence of portable oxygen devices and remove them from the vehicle if possible and safe to do so. Alert firefighters to their presence and location. Remember, you are responsible for directing passengers and passers-by until safety personnel arrive. At that point, your responsibility is attending to the needs of your passengers. Fire extinguishers. Fire extinguishers should be on all vehicles and are an essential piece of emergency equipment. Fires require fuel, oxygen, and heat to burn properly. Remove one and the fire will go out. A typical vehicle fire extinguisher will last only 15 to 20 seconds. Remember the word pass. P stands for pull the pin. A, aim towards the base of the fire. S, squeeze the handle. S, sweep the extinguisher back and forth at the base of the fire. On to our quiz over Part 7. Number 1, true or false? In the event of an emergency, everyone is responsible for their own safety. The answer to number 1 is false. Number 2, following an accident, you should always evacuate your vehicle immediately if you smell smoke or fuel, B, passengers are scared or frightened, C, a passenger has been injured, D, the occupants of another vehicle need your help. The answer to number 2 is A. Question number 3. A typical vehicle fire extinguisher will operate for approximately A, 3 minutes, B, 5 minutes, C, 15 to 20 seconds, or D, 60 seconds. The answer to number 3 is C, 15 to 20 seconds. Question number 4. When evacuating your vehicle during an emergency, you should avoid A, secondary hazards such as oncoming traffic, B, causing passenger stress, C, forgetting your personal belongings, or D, all of the above. The answer to number 4 is A, secondary hazards such as oncoming traffic. Number 5, true or false? During an emergency evacuation, you should quickly decide whether you have time and it is safe to remove any portable oxygen devices from the vehicle. The answer to number 5 is true. Number 6, true or false? In the event of an emergency, your main responsibility is handling the situation in a way that lessens the risk of injury or death to your passengers and yourself, even at the expense of your vehicle or company property. The answer to number 6 is true. Number 7, when operating a fire extinguisher, you should aim at A, the hottest part of the fire, B, the base of the fire, or C, the top of the fire. The answer to number 7 is B. Number 8, once emergency response personnel have arrived at the scene of an accident, your primary responsibility as a driver is A, to determine the extent of damage to your vehicle, B, to call dispatch and inform them of the accident, C, to attend to the needs of your passengers, or D, to find witnesses who can corroborate your side of the story. The answer to number 8 is C. Number 9, true or false? During an emergency, your own safety is not important. The answer to number 9 is false. Number 10, true or false? During vehicle evacuation, you should never leave a passenger's wheelchair behind. The answer to number 10 is false. Thank you. This concludes our passenger assistance training. Thank you for participating, and thank you for being a part of our mission, connecting communities and improving quality of life for all.